Good evening, lovely viewers, to today's edition of Health Talk on News Ghana Clock. It's all about your health and what to look out for in order to stay safe. Just as Mahatma Gandhi said, and I quote, "Good health is real wealth and not pieces of gold and silver." Today, our topic for discussion is chancroid, as people normally say, cancroid. And here with me is a professional pharmacist who have been practicing pharmacy for over 24 years. I personally call him Dr. Too Cute. He's no other person than Mr. Michael Kofi. We will go for a quick breather. Please do stay. Thanks for staying here with us. Now moving straight to our topic for today's discussion, which I mentioned earlier, is cancroid and is a sexually transmitted infection. Remember, with the previous weeks, we spoke about some sexually transmitted infections, which cancroid is no exemption. This disease or infection has generated a lot of controversies, myths, and then questions people normally ask because it is some way or somehow synonymous to some of the sexually transmitted infection. But today we have here in our midst our professional pharmacist who would digest the issues for us to understand what cancroid is and how synonymous it is with the other sexually transmitted infections. Welcome, Mr. Michael Kofi, to Health Talk on News Ghana Clock.
Thank you for having me, Kelly. You look splendid.
Thank you. I like your smile as well.
Thank you.
All right. So, doctor, what is cancroid? As people normally say, chancroid. What is it about?
Okay, cancroid or chancroid, as some people call it, is actually one of the sexually transmitted infections or diseases caused by a certain bacteria. It's called Haemophilus ducreyi. And when we say something is hemophilus, it means it's blood-loving. It loves blood.
Wow.
Unfortunately for us as humans, this organism doesn't only love blood from certain parts of our bodies, but our genital areas.
Specifically
our genital areas. For the women, the labia, and then the entrance to the vagina. And then for we, the men, the penis or the scrotum, the testicles. So it is an organism that will love to have blood from these areas. And once they get there, they make sores in that area. And that sore can then come out with blood that contains these organisms to be transmitted into other people. And so either the blood that it is used or the fluid that comes out of the sore that it makes will be contaminated with the organism. So if you have oral sex, vaginal sex, or anal sex with that person, then you are also at risk of getting the infection. So this is cancroid, and then how it is actually presented in the human body. It happens in both males and females, but then they present similarly or differently, depending on the number of sores or the sites where they occupy.
All right, so looking at cancroid, what will you say are the people who are at risk when it comes to cancroid?
Yes, thank you very much. Cancroid, like all the other sexually transmitted diseases, can be transmitted through sex. So people who are sexually very active are at risk.
All right, so let me chip this in. You are saying that people who are sexually active are at risk, but then there are these controversies and myths out there that it doesn't really matter that you should be sexually active or you should have a particular sexual history or encounter with a lot of people, like have multiple sexual partners, but then the moment you have it with someone who has that infection, you will be easily affected with it. How is that possible?
That is very true. Your myth could be true to some extent, in the sense that one person might not have had multiple sex partners, but if you are not lucky and the first partner you have has the problem, then it means that you stand at risk of getting it, even though it could be your first time. It could be through kissing, it could be through oral sex, it could be through anal or vaginal sex, as we've already stated. but then it could have been your first time. But the reason we say that people who are mostly at risk are the sexually active people is that because they have so many partners, the chance or probability of them getting it is much higher than the general population. That's why we say it, that they are mostly at risk. It doesn't necessarily mean that they are infected. But then if we talk about risk levels, then they have a higher risk than those who have fewer partners.
All right, so in ranging the risk, people who can fall at risk, looking at this particular disease, we can say prostitutes.
Yes.
Fall at risk,
yes,
when it comes
because they
to...
have so many partners. Some they don't even know where they come from. They just go and one night they don't even inspect the genitals to see whether there are any sores or any ulcers at all, and then they jump into bed with them because they need their money.
All right, so following that, how would you know that one has chancroid, and then, or in other words, the signs and symptoms when it comes to the male and then the female? How would you know that?
Okay, I'll go back to that, but you were asking earlier about those at risk, and I mentioned only one, but they are not the only people that are at risk. In fact, poverty is known to be one of the risk factors.
Wow.
Because when you're poor, then you are ready to do anything. So if somebody offers you something to have his way with you, you might not take precaution because you are hungry, you need something, and so you jump to bed. And it is also known that this disease actually affects people in deprived areas where there's scarcity of food, where there isn't good water supply, where healthcare and shelter needs are very, very scarce, because then they will not be able to access all these facilities, and then they might stand a risk of having this problem. Then people who have sex with commercial sex workers. So it's not only the commercial sex workers, but their patrons are also at risk. So those who visit the prostitutes, if you don't take precaution, you could come out back with chancroid. Then those who abuse drugs or alcohol. Drug abuse will make you throw caution to the wind, or alcohol abuse, and so once you are in the mood, you might not necessarily take precaution to even wear the condom. You might not even know where the condom is to even wear it, because you are so tipsy.
Yeah, so doctor, a quick one there before I forget. You said poverty, people who are at risk. Is it that the person can't avoid some basic necessities when we come to, example, probably getting a 3 square meal for yourself or something, and so you are pushed to do certain things, and then also the other aspects which has to do with people living in poor environments and all that? Can you please explain it very well?
Poverty can drive people to do anything. For instance, Kelly, let's face it, you are a young girl, and then for a whole day you've not eaten. Your parents are unable to give you the money to even buy food. And then a gentleman comes your way and say, oh, you're a very beautiful girl. Kelly, I love you. Let me, I will give you a lot of money, but just one shot with me. You might, out of that situation you are in, follow that person and throw caution to the wind. Again, those who are poor and they can't provide themselves with the basic nutrition that they need, okay, the balanced diet, you know that your immune system would also be compromised. And immunity is very, very important for prevention of infections. So once you are unable to eat a balanced diet that can help you with improvement in your immune system, any disease at all can affect or afflict you. Wow, and that is why
I think the problem is. With relating to the immune system, does that make it that if someone has HIV, meaning the immune system is very weak, and so that person can easily be infected with chancroid? Isn't that possible? You
are very right. It means that you have really read ahead in this particular topic. Yes, for those who have HIV or who are HIV positive, it is known that when they have chancroid, because they are immunocompromised, the immune system is gone down, and the immune system is also supposed to help you with the healing of sores and things like that. So once there's a sore there and your immune system is compromised, then it means you have a problem. And the same as those who have diabetes. Once you are diabetic and you get any sore, it takes a long time to heal. So it also means that if you are diabetic, you should have cancer. It will take much longer time to heal than the general population of people who might not be diabetic. So anything that makes your immune system go down, be it malnutrition, be it diabetes, be it HIV or any other condition that makes your immune system get down, would also ensure that your cancer, if you should get it, would take much longer to heal than the general population.
All right.
And then people with multiple sex partners
Okay.
can also be at risk.
All right. So quickly, let's look at some effects. If you are affected with such infections or disease, what are some of the effects? What are some of the problems you would face, or the challenges you will face, or battles you will go through in terms of recovering, or even if you are not recovering? Because we know some people don't even treat it at all, because they see it as something minute, and then probably boom, it turns into something extraordinary you can't even handle, because this disease is quite stronger, if I can say, it's quite stronger than probably syphilis or gonorrhea. Is very dangerous, I guess.
Yes, the danger with cancer is that when it affects any of your lymph nodes in any part of the body, and then it ruptures, it can become contagious. So you might not even have sex with the person, but once you get into contact with that best lymph node, and your skin is also broken, you haven't had sex. It's a sexually transmitted infection or disease, but then you can also get it. But then, when you have it, it takes between 4 days upwards to manifest, 4 to 7 days before you see the symptoms. And the symptoms vary from men and women. For the men, it comes as a bomb on your penis or on your testes, as I've already said. And then the least thing, it ruptures and becomes a sore. And then it may affect your genitals, okay, including your scrotum as well. You understand? And then the ulcers are frequently very painful.
Doctor,
so it distinguishes it from syphilis. You see that the syphilis sore comes as a painless sore.
Okay.
This one
comes
with pain. So at the onset, if you want to know the difference, this is one of the basic difference. And then this of cancer comes like gray to yellowish gray bump, which with the least touch can burst and become a sore, which can induce pain. And for the women, it can come as 4 or more bumps, okay, or sores on the labia of the vagina.
Okay.
The labia is actually the skin fold at the female genital area.
Okay.
The like the lip. So
okay,
it comes as 4 or more of such on the labia, which can become very painful. Okay, so it also means that if you should have it and you are having sex, it could also be very painful. So it means that women who might have cancer,
I think that can lead to sexual dysfunction.
Yes, you are right. When we treated sexual dysfunction, we saw that anything that induces pain and will not make the person give off his best or her best in the sexual cascade, the various processes that you have to go through to enjoy sex, leads to sexual dysfunction. So somebody with cancer would also likely suffer from sexual dysfunction. Then for the women, as I was saying, there will be pain and burning sensation, especially after even urination or during urination. And when there's bowel movements, say you are even in the washroom
trying to free your bowels,
then you start feeling pain or burning sensations, and then it tells you that it could be cancer.
All right. So, doctor, how do we go about the diagnosis of cancer if someone is being infected with such disease?
Okay, thank you very much. The diagnosis can only be done at the laboratory, unless, of course, you are somebody who has enough experience about cancer, like the clinicians. When they see one, they can tell. So, otherwise, they will take a sample from the whatever exudates of the sore, and then they take it to the lab, and then they evaluate, and then it shows that there's that organism, Haemophilus ducreyi, inside. The other thing is that you can't take blood sample from the body to test for chancroid. You have to take a sample from that portion where the sore is.
Okay, because that part is infected. So there, it is actually compulsory to take it from that infected part.
Yes.
And not that you can just take it from any part.
Okay. And then some of the doctors too will examine your groin and see that the groin area, the nodes could also be inflamed. In fact, sometimes it could be even inflamed to the extent that it can rupture. And then it becomes very, very contagious, even to people who haven't had sex with you, but then you can easily transfer it to them.
Oh, okay. So, how do we treat it? Basically, how do we treat it if someone needs treatment, if someone is infected with chancroid?
Chancroid is treated at the hospital by the clinician who knows what it is after he has done the test or clinical presentation of the condition shows that you have chancroid. We normally use antibiotics, and there are various antibiotics that we use. You can use certain ones, azithromycin, ceftriaxone, erythromycin, and even doxycycline, depending on that kind of organism that is isolated. But it's not for you to do the treatment. Your doctor will find an appropriate antibiotic for you to treat it.
Alright, so to our cherished viewers, it is not for you to do the treatment, but your clinician will find a comfortable way of treating you so that you become free of this deadly and dangerous infection or disease. Alright, so doctor, what are your last words to our cherished viewers? My last words
is that prevention is better than cure.
Thank you.
So prevent the infection in the first place. Please, if you can't abstain from sex, use the condom to protect yourself. Engage in safe sex. Don't engage in having sex with multiple partners. And then always be careful before you take any decision, especially if you are young, because a lot of young people, out of curiosity and exuberance, would want to test certain things. Be careful, otherwise you might give yourself a lifetime of sorrow if you are not careful. And again, one way of preventing it is also to alert your partner if you see that you have it. Otherwise, a lot of problems might happen. The person will keep giving it to you and also giving it to other people. So my cherished viewers and listeners, we have to be very, very careful about some of these diseases, because they could cause a lot of damage to your sex organs. Thank you.
All right, thank you, doctor. So you heard it all. You have to be very alert. Tell your partner so that they do some checkups to see whether you guys are okay. And then also to our youth out there, avoid being so curious about everything and you want to test everything. In fact, it will surprise you to know that the little kiss or sex, unprotected sex you have with someone, you may get yourself infected with this deadly infection which we call chancroid, and people normally say chancroid. This is all what time will allow us on Health Talk on News Ghana Clock. Remember, this production was brought to you by Ambulance Media Communications. Please do well to follow us on our various social media handles on Facebook, YouTube, and on Instagram, or at News Ghana Clock. I'm always your host, Kelly Foley. Thanks for watching, and do well to watch our next program same time. Thank you very much.